Hi everyone, Dr. Kolaiko here checking in, and today I want to talk about some of the news reports of some of the serious health events that have followed vaccination with following either the Moderna or the Pfizer vaccines. So we are hearing reports that there have been a cluster of allergic reactions following vaccination with the Moderna vaccine in individuals who were at a specific clinic in San Diego, California. So there were 10 cases of allergies at this one clinic that happened shortly after vaccination, and that is currently being investigated. So, in the meantime, out of an abundance of caution, the California Department of Public Health has instructed those of us who are vaccine providers not to give any of the vaccines with that specific lot number. So, that specific batch of vaccine that came from Moderna, just in case it might be, associated with something in that specific batch of vaccine. And so we are not using that vaccine, we are not distributing that specific batch of vaccine. And as you can imagine, this has caused a setback in terms of the supply of vaccines in the community. So we've already been experiencing a lot of challenges trying to meet the demand. There's a lot of demand for the vaccine, which is great, but there are not enough of us who are vaccinators to be able to keep up with the demand. So this supply issue is definitely causing some setbacks and some frustration on the part of both vaccine providers as well as patients. But we see this in the grand scheme of things. Hopefully this is a minor setback, and we hope to learn more information as far as what might be causing this cluster of allergic reactions in the near future. But the other batches of vaccine are not affected. So to give you a little bit of context, at our community pharmacies, we have provided hundreds of doses of the Moderna vaccine, and so far, thankfully, have not had any severe allergic reactions. So we've had a lot of sore arms, we've had a lot of people saying that they feel fatigued, we've had some people complaining of chills and low-grade fevers. We had one individual develop a rash on the arm that they received the vaccine on, which went away with Benadryl. But thankfully, so far, no serious allergic reactions. So that kind of points to the importance of having that 15-minute observation period after you get your vaccine. So you will be asked, to wait around for 15 minutes just in case you start feeling unwell. And so things to look out for if you're, signs of a serious allergic reaction might include feeling generally unwell, feeling anxious, having maybe general itching all over, and eventually feeling, like your throat might be closing or it gets difficult to breathe. So if that's happening, that's an emergency. That's called anaphylaxis. That's a serious allergic reaction. So that's when, the pharmacist or the healthcare provider will give you epinephrine. It's an injection in the side of your thigh that will help stop that allergic reaction, and they will have you taken to the emergency room for follow-up. So each pharmacy or clinic or vaccination center will have a protocol in place just in case of serious allergic reactions. It's important to remember that these serious reactions are very rare. So they are highly publicized in the news, but they are very rare. So it might happen, but it's very unlikely. So I want you to keep that in mind. Now, we also are hearing reports from Norway of some deaths in elderly, frail nursing home residents. So there were 23 deaths that were reported in nursing home residents following vaccination with the Pfizer vaccine. Now, all deaths are tragic, and so the Norwegian Medicines Agency is currently doing an investigation into the cause of these deaths. So we do not know whether the vaccines were a factor in causing the deaths at this time. So the agency has speculated there is a possibility if you have a very elderly, frail individual that let's say they develop a high fever or they develop severe nausea and vomiting. those type of events, if you're extremely frail, could cause a lot of stress to the body, resulting in organ failure and death. And so they are investigating whether those deaths are in fact linked to the vaccines or not. It is important to keep in mind that there are 400 deaths in nursing homes every week. And as far as this news report that's associated with the vaccine, this was 23 deaths. So that gives you a little bit of context. It may be linked or it may be coincidental. So oftentimes there are serious health events that may happen after vaccination or after other types of medical interventions. It doesn't necessarily mean that those events are caused by the vaccination or caused by the medical intervention. It means that they're associated. And so that's why it's very important to allow the appropriate agencies to do their investigation thoroughly and completely so that we can have a better understanding of what the actual cause of those events are. So more information will be forthcoming, and I will share that with you as I learn it myself. Also, one important update is that there have been 44 million doses of the vaccine given globally around the world. And of those, 14.7 million vaccines have been given in the US, COVID-19 vaccines. And so far, serious side effects are very rare. So, that also gives you a little bit more context to put it in. Now, the CDC puts out a weekly report. It's called the MMWR, the Morbidity and Mortality Weekly Report. They have these reports specific to different diseases, cancers, etc. They have one specific to COVID-19. And this is where they report on sickness and death associated with COVID-19 and the vaccines now that that's available. So we expect more information to be coming out in terms of any serious safety signals associated with the vaccines. At this time, we don't have any red flags that are coming up. They do have one report on the few allergic reactions that have happened following vaccination. And so far, they've had a lot more to report on in terms of deaths from COVID-19 disease itself. So that is a reminder to us all of that risk-benefit balance. So at this time, based on what we know, the risk of serious illness and death from COVID-19 still far outweighs any potential, safety concerns with the vaccines itself. So hope that's a helpful update for you, and I'll check in again when we have more information. Thank you.